Hey everybody, long time no see. I'm aware that it looks like I just climbed a mountain, came back down, and still haven't gotten a haircut. Is what it is. I've been lifting a lot more, getting back into the gym, and getting right back into researching all the pharmacology I love to research for everybody. So, when I say research, I do want to be clear that I'm not somebody who's scouring the internet reading every single article, or scientific journal or anything that I can find on these subjects. I find what I can find, and I don't have a lot of access to things that maybe people who got college degrees had access to. So, please remember that. I am not in any way, shape, or form a doctor or somebody who's a pharmacist or anything like that. So just keep that in mind. And I should probably say my disclaimer of that. So I'm not a doctor. I'm not a chemist. I'm not a neurologist or anything that has to do with the medical field. I don't give you guys this information for any practical use. It's really just for educational and entertainment purposes. And I do mean that I legitimately am not somebody who's trying to give advice, because I just find these subjects matters fun. And so I like to talk to you guys about it. And hopefully you guys do too, because a lot of you guys keep coming back for my videos. So today we're going to be talking about pump products, and the two pump products that people may be aware with in the other type of pump is Cialis and Viagra, aka sildenafil and tadalafil. Hopefully I said those right and didn't sound like an absolute moron. But they have both been utilized in bodybuilding for a while now, and in weightlifting in general. A lot of people utilize them just to get more pump in the gym. So when you're in the gym, you may be able to constrict more blood into an area and get more blood flow to an area if you're using these pump products, because these are vasodilators. Now, granted, they're vasodilators very good at one specific portion of the body, which is kind of how they became known for the medication that they are. Originally, they were actually focused on being a medication for high blood pressure, though, and it was kind of funny from the way that I heard a doctor explain it. When they were doing the clinical trial, all the guys took the medicine, and their rates were looking good and everything like that. And then they went back to the hospital later, and they're like, "Hey, can I have some more?" And the doctors are like, "Well, I mean, the clinical trial's over. We can't just hand out more to you." And they're like, "Well, I mean, it's kind of been working for some other stuff too." And then they kind of found out that it was really useful as an ED medication, especially for older men who have poor blood flow. And so what we figured out as like weightlifters and bodybuilders is that it's really useful for pump. And so the pump is not necessarily what gives you the most hypertrophy in any given situation, but for the most part, we know that it is beneficial, and at some level, there is a nutrient. What's the phrasing I'm looking for? Nutrient delivery system that when you increase vasodilation, you can actually get more nutrients delivered to that one area so that you can actually recover better. There has been some research into this. So I believe both Cialis and Viagra, or tadalafil and sildenafil, have been looked in for recovery time and muscle building effect. Now, I believe the recovery time in the very, very short term was not shown to be that great, but when they extrapolated it out to 2 weeks, this is for sildenafil or Viagra, I believe. After 2 weeks, they actually discovered that these guys were able to lift more weight, or weight closer to their original weight, without having a higher perceived exertion rate compared to the placebo group. I don't know if it was reflected to be very statistically significant or not. I can't remember that portion of the article that I read, but I believe the p-value was under 5, under the 0.05 marker. So I believe it was statistically significant in that regard. Now, there was one paper that went around for a while, one scientific paper, that was saying that Viagra was as potent at protein synthesis as like testosterone. Now, pretty much every single person who's ever been on testosterone and Viagra knows that that's not really true. There does seem to be some protein synthesis benefit, to be clear, in my opinion, but I don't think it's the case at all that it somehow increases protein synthesis to the rate that an actual bioidentical hormone would do it. Now, the question I have about it is, what mechanism do we truly see a benefit from, if any? So, a lot of the time when bodybuilders are utilizing it, they're utilizing it right before they go on stage for a competition. So they take it, they do their pump so that they get more blood flow and inflammation specifically in a muscle or in their muscles, so that when they go on stage, they're all pumped and they all have the crazy veins and everything like that. Now, we do have some over-the-counter supplements that work in the same way. I believe L-Citrulline is the most prominent one. I don't know of many others that really increase nitric oxide boosting like L-Citrulline does. I always confuse L-Citrulline and L-Citrulline, and I think it's just because one is an actual, like, sertraline is a drug name and citrulline is L-Citrulline in the vasodilation context. So the question I have is it really that potent, if at all, as far as increasing muscle mass? And even if it's not, does its recoverability actually yield in the long term a more potent muscle mass effect? Because if somebody is able to recover faster, then they are able to do more volume, which would actually yield them more muscle, which is in a similar context to why people love creatine so much, because creatine allows you to recover a lot faster between sets, for example. And so creatine is actually looked at as being muscle growth inducing, but it's not actually. It just allows you to lift more weights more frequently so that you are not as tired, and because of that fact, you can actually grow more muscle tissue because you increase the amount of load bearing and volume that you're actually doing. And I'm wondering if any of the muscle growth effects, sorry, I got an itch on my nose, if any of the muscle growth effects that we see from sildenafil and tadalafil are actually just because there is a decreased level of recoverability or increased level of recoverability, and doesn't actually dramatically increase protein synthesis. Now, I am highly skeptical that it would increase protein synthesis anywhere near the rate of, I think they said in the scientific journal that it was like 200 milligrams of testosterone equivalent, which I'm extremely skeptical of. If it is the case, that would be extremely interesting and could be another avenue that people could utilize and not completely wreck their body with more hormones. But I don't know. I'm, again, not a doctor, so that one is kind of beyond my scope of understanding, but I do find it interesting that so many people continue to utilize it on a daily basis, and there does seem to be some ability to allow the nutrients to go into the muscle at a better rate, and because of that fact, the muscles can either recover better or get bigger, and the specifics of it don't seem to be very clearly known. I do know some people who have tried using their ED medication for exercising, and it definitely yields them a larger pump in the gym, which theoretically would yield them more progress in the long term. That's part of arguably why pump products are so important in the first place. Is the idea is that if you are able to put more physiological stress on the muscle, aka giving it more blood and inflammation, it will actually grow more. And there does seem to be truth to that, at least to some extent. Now, not to say that if you're not getting a wild pump every time, you're not going to grow. That's not what I'm saying. But it does seem to be beneficial in some sort of way. Again, the particulars of it are not well understood from what I was able to tell, but it does seem to be beneficial. Otherwise, a lot of people want to be utilizing it. Now, the other avenue that a lot of bodybuilders still use it for, which is kind of like old school science, I don't necessarily advise this in any regard, but a lot of bodybuilders will get high blood pressure from using all their steroids and being on massive amounts of food and doing all this crazy stuff and taking an insulin, and so they have high blood pressure. Not to mention, I'm sure a lot of them love their pre-workout, but regardless, their blood pressure will raise. And because of that, or at least for a lot of people, I should say, and because of that, having a vasodilator can actually allow your blood pressure to decrease because you're actually widening the veins and arteries, so it allows the blood flow to actually be less impeded. Now, is it that profound? I don't really know. I don't think that ED medications are regularly given out as blood pressure medications. I'm fairly certain that the sartan group of medications is much more efficacious, like telmisartan, losartan. Those type of medications have been shown to be much more beneficial in a context of decreasing cardiovascular risk due to high blood pressure. But overall, I mean, I think that is an interesting thing to think about because bodybuilders love polypharmacy. They love doing this drug to counteract this thing and do this drug to fix this thing. And I mean, even in the older days where it was just like, take your testosterone, and then they'd get too much testosterone, and then they'd get gynecomastia, or they'd get too high of blood pressure, they'd say, oh, that's an easy fix. Just take this anti-estrogen. And then they'd have a bunch of anti-estrogen side effects, and they're like, oh, okay, well, now you need to introduce some D-bol. And so there were always these cascading effects from polypharmacy. And I do find it fascinating the ways that kind of bro science continued on this kind of like idea of chemistry mangling the body, and it seems to be continued to this day in terms of utilizing things like Cialis and Viagra to help lower blood pressure. But anyways, if you guys have any experience with utilizing Cialis and Viagra, like your ED medications, to increase gym pump and otherwise increase performance when it comes to exercise, I would love to learn about it in a case study context. So if you just have your own personal thing, or I should say a subjective context. And if anybody can link any articles about the protein synthesis action of Viagra and Cialis, I would be over the moon, because I've only seen the one article, and as we know, we cannot conclude a large amount of, science. We can't conclude a lot of information from one study, because everybody knows one study can be flawed. There's always a meta-analysis that always has one major outlier that doesn't match at all with all of the other studies concluded on it, and so that's why meta-analyses are important. But anyway, I hope you guys enjoyed the video. If you did, please give it a like, subscribe to my channel, watch some other videos while you're at it. I have a bunch of videos talking about muscle building and what bodybuilders do and what strongmen do and all this different crazy stuff, and some experiments that I've run with over-the-counter supplements and what I was prescribed from my physician. But as always, that's going to do it for me. Remember to keep your shoulders back and down when you lift, and hope you guys have a great one.